with Sarath, because Sarath was not here, even though I went through it partly. And then after the assignment session, we will look at infection control, which is the last bit of the unit. Even though I covered it, but then there is still an aspect that we need to cover, so that when we have Nina, then we could go through the assignment. The assignment will not take a lot of time, so we could do that at the beginning of the next lesson. Would that be okay?
Yes, that's
all
right.
Right. Okay, thank you, Mercy. Right, so I'm just going to close the referencing PowerPoint, and then we get the PowerPoint on. Sarah, can you see the slide? Okay.
Yes.
Yeah, give me a second.
Yes, Chris.
Right, so in our last lesson or session, we covered broadly health and safety in adult care. And an aspect of health and safety has to do with infection control, which enhances and supports healthy living. And that is what we're going to go through. Before we go through that, let me just cover with us let's look at some of the questions that have to do with that. So then it becomes easy to comprehend why.
Chris, actually your voice is breaking. I think my network is down.
Oh, okay.
Hear anything. Your voice is breaking one by one. Yeah. I
my
can't
voice
see
is breaking.
Now it's fine. Yeah, now fine.
Is it okay now?
I thought. Yeah, now it's fine.
Okay. That is good. Thank you. Let me know if you can't hear me at any point.
Yeah, of course.
Okay. Right. So to begin with, let's look at a breakdown, and then I'll come back to the PowerPoint presentation, considering that we have just an hour. All right, so this is the assignment for health and safety in adult care. So health and safety basically has to do with how to ensure that you as a health and social care professional, you are healthy and you are safe to go to work. You are healthy to work, you are safe to go to work, number one. Number two, how the employer is supposed to ensure that the work environment is healthy for you working there, number one. Number two, healthy for the residents or the individuals or the service users, and is safe for them. So you're looking at the environment, a healthy and a safe environment.
The assignment topic is health and safety
in adult care. Did you get that, Sarah? Yeah.
Chris.
Yes.
Yeah, the assignment topic is health and safety in adult care.
That's correct.
Am I right?
Yes,
yeah,
you're right.
Fine.
Yeah, right.
Actually, my internet down, so it's.
Oh, okay then. Right. So this is the scenario we have. And everything stems from the scenario. As the appointed and responsible individual for health and safety in your adult care setting. So the adult care setting may be a care home, a residential home, a daycare center, or wherever the adults or the elderly are being taken care of. It could be a very sheltered residential home. So as the appointed and responsible individual for health and safety in your adult setting, you are required to prepare a health and safety handbook as a training manual for training health care assistants and support workers. That is the scenario. And the manual that you prepare should cover the following. And so the following are the assignments that we consider. So task one, we're looking at, summarize the legislative framework. The keyword is legislative framework for health and safety in adult care setting. Simply says, what are the laws that govern working in an adult health setting? Maybe care home, residential home, nursing home, very sheltered residential home. What are the laws that govern working there, the working conditions, and how healthy and safe the place should be for the service users or the individuals or the residents? So to answer this question, we expect you to summarize 5 main laws or government regulations. Laws or what? Government what? Regulations. So legislation or legislative framework means what are the laws or the regulations that govern it. So in your answer, you talk about 5 main laws and government or government regulations relating to health and safety in an adult care setting. So in your answer, you have to indicate that you're writing about a care home, or you have to indicate that you are writing about a residential home for the elderly, or a nursing home. You have to indicate which particular adult care setting you're talking about. Okay, and all of these are in the PowerPoint that has been sent to you. Okay, so the second question is, describe key sources of information and guidance. Keywords to look out for is sources of information and guidance. Sources of information simply means, where would you find information from? And the second one, guidance, means how would you know what is the right thing to do or what is not the right thing to do? So there you'll be talking about policies and procedures, guidance. So sources of information and guidance for health and safety in your workplace. Describe. So to answer this question, we expect you to describe 4 sources where you will find information and guide on health and safety in adult workplace, in adult care workplace. So for example, you're talking about your workplace policy. So I've given you some guides here. You're talking about, so in your policy, you will find the information, the sources of information. Then you have staff handbook. The staff handbook tells you, the staff handbook most of the time will have the policies. It will also tell you what the do's are, what the don'ts are. It will tell you what the procedures of this workplace are. It will tell you when you feel sick, this is the procedure to follow. If you have complaints, this is the procedure to follow. It will give it, it is the to do, the how and what to do manual. Then we have the HSC poster. HSC simply means Health and Safety Executive poster or website. The poster is there in the website. The HSC poster, the Health and Safety poster, is what is required to be in every workplace, every health and social care related workplace, including all fish and chips shops, chicken and chips shops, Pizza Huts, because they are also regulated. And from time to time, the hygiene, the food hygiene, officials do go there to do inspections and to ensure that the place is healthy and food is being prepared in hygienic conditions. It also includes restaurants and all places where food is prepared for the public. Then we have government websites. We have the various legislations and regulations, pieces of them. So I've given you some ideas. We've given you some ideas as to what you would need to write about and describe. Okay, please do stop me if you have a question. So for task 2, this is task 2. Task 2, which covered learning outcome 2. 2.1, evaluate your own role, responsibilities, and accountability in relation to infection prevention and control. So it's talking about the same thing, how to control infection and how to prevent infection. Infection prevention and infection control. What is your role or your responsibility as a healthcare practitioner, as a care home manager, or a deputy manager, or anyone in a managerial role in relation to how to prevent infection and how to control infection at the workplace? So here you would also include the strengths and weaknesses, positives or negatives, advantages and disadvantages of your role, because it says evaluate. So the key command word here is evaluate. We're going to look at command words, particularly when we get the rest of the group E. So this is what we expect you to do. We're going to look at some of the rules again in what I'm going to cover briefly on the next lesson. Then please stop me if you have a question or something is not very clear, okay? So at 2.2, explain. So explain, this is very simple then. Explain how to recognize and how to manage and how to respond to outbreaks of infection in the workplace. For example, during the pandemic was an outbreak. Viruses were happening and stringent measures were taken different ways to control it. If you just have that picture in your mind, so how do you recognize an outbreak of infection? Number 2, how do you manage an outbreak of infection? And how do you respond to an outbreak of infection in the workplace? So what to do to answer this question? We want you to explain how you will recognize and what 4 steps or measures or procedures you would take to control the spread of infection at the workplace. Okay, we're going to look at some of them again. Then 2.3.
Chris, I think Sirat wants the permission to let in the Zoom.
Oh, really? I think Mansi could help us with that.
No, just click on that let in. He must be asking you the permission. He messaged me.
Oh, okay. Sarat is in already.
He's asking for the permission.
Really? Hello, Sarat, can you hear us?
I can hear.
Okay, yeah. Thank you, Nina.
Okay.
It's in now. Thank you so much. Yeah, I didn't know you were in. We were looking for you. We were waiting for you. How are you, Nina?
I'm good. Sorry for late today.
No, that's fine. We understand. Yeah. Okay, so yes.
Just wanted to ask you from the beginning, can you please show the question number 1?
Yes.
1.1. Yeah, this is 1 second, training manual. Yeah, where it says that we have to prepare a training manual for the healthcare assistants.
Yes.
So will there be any different format to do this answer?
No, there will not be a different format. That's a very good question. Thank you, Nina, for asking. So that is just the scenario. So that the information you put here will be used to prepare the training manual. But in doing your assignment, we will just require you to just answer the questions below under the question, just on the template like this. That's fine. Does that answer your question?
So we'll just write the answers the way we write, like in paragraph form.
Absolutely. Yes.
Okay, so nothing got to do with the training manual book or something.
No.
Because in that case, we can highlight it like a bullet and then write not much, like just a summary, like the short in it, like a brief answers the briefly.
Under it, yeah. If it says summarize, that's what you do.
So we can do like that, maybe like to give it a handout format.
Yes, you can do that but then you just do it on this template, just as you do your other assignments. You just do the same. But
Okay.
the scenario is just painting a picture. So you know that this is the basis on which you are answering the questions. Does that answer your question, Nina? Okay.
So we'll answer it normally, basically.
Yes, please.
Okay.
Yeah.
Okay. Thank you, please.
Thank you. Right. So we now on 2.3. Analyze. The command word is analyze. What are we supposed to analyze? How policies and procedures in your own work setting meet regulatory requirements and current guidance. This is very important. Regulatory requirements and current guidance for infection prevention and control. What this question simply means is this. First thing, we need to remember that we are doing an analysis. What are we analyzing? How our workplace policy, the place that I work, how the policies and the procedures in that workplace meet the government requirements and current guidance. What is government requirements? That is the law. So let's assume I'm working in a care home. I'm the deputy manager or I'm the manager. I must make sure that the policies of that care home or my care home cover all the relevant health and safety laws and regulations for both staff and the service users who are working or living in that environment. Current guidance means if there is any change in the law, the policy must also reflect it. So one of the things that I'll be looking at in answering this question would be, how often is the workplace policy and procedure reviewed and updated? Because if inspectors come, they want to find out if the policy is up to date. For example, if there is any change in law today, they have to make sure that the change in the law is reflected in the policy so that the policy is current and is up to date. So how do we answer this question? Analyze how your workplace policy and procedures on infection prevention and infection control are updated and kept current. Now, those of us who have been in London for about the past 3 to 4 years would have heard of the Grenfell fire. Are we all familiar with the Grenfell fire? And part of the cause of the fire is a health and safety related things, because fire has to do with health and safety. So that's why we have fire training and first aid and other things. They all fall under health and safety. Part of the cause of the fire was what they refer to as cladding. And because of that, there was a major change in law regarding construction of buildings and cladding. So let's assume someone is working in a place where such related change in law has occurred. Very quickly, you as the manager or deputy manager must make sure, if it is related to what we are talking about, that you update your workplace policy to reflect the change in the law. So inspectors, when they come, Care Quality Commission, CQC, want to see whether your policies, your workplace policies, are up to date or they are outdated. If they are outdated, there is trouble. Okay, so that's what this question is referring to. Then 2.4, explain how to ensure proportionate approach to the implementation of infection control and infection prevention and infection control measures. So the key words to take note of is proportionate what? Approach. This simply means, how will you ensure compliance with workplace policies and procedures? This is what is giving you the clue, implementation. How will you as a manager or a deputy manager ensure compliance? How will you ensure that management or employee complies with the law? How will you employ that employers or staff comply with the law to make sure the right thing is done? The policy is followed, the procedures are followed appropriately. So that's basically what it says. So there should be monitoring, there should be review, there should be assessment, regular monitoring, regular assessment, regular reviews. And staff who do not follow should be reprimanded, should be disciplined. There should be warnings given to people who do not follow the policy and the procedures to serve as a deterrent to others, so that everyone makes sure they are following and doing the right thing. Reviews. Okay, assessments. Monitoring. Warnings to defaulters, etc. Right? And then that brings us to task 3. The good news is that task 3 and 4, how do you call it? Learning outcome 3 and 4, you don't have questions to write on there. Most of them are observations. So you have only one question to answer here. So this is one very simple unit that you can finish very quickly. So the last question, which is task 3, says evaluate and improve health and safety policies, procedures, and practices. So what we would need you to do here is you have to talk about how you will evaluate your workplace policies, procedures, and practices to see to it that they are up. Okay, I'm changing all of this, so just give me one second. To see to it that they are up to date. And then which recommendations will you make for improvement? How will you improve? Evaluate your workplace policies, procedures, and practices to see to it that they are up to date. And then you will also be required to make recommendations. So you look at the policies and see, are they up to date? If they are not up to date, why are they not up to date? And what recommendations would you make for it to ensure that they are improved upon and always updated? So some of the recommendations you will make will be that, okay, you recommend that the policy should be reviewed every 1 year, annually, in order to reflect the change in the law and the change in the regulation, because every now and then things are changing. New laws are coming into being, laws are being updated, changes are happening. And so part of the responsibility of management, you as a manager or deputy manager, is to know what change in the law is there and ensure that the change is reflected in the policy and the procedure of the workplace, so you are not in trouble with Care Quality Commission when they do come to visit. And that is the end of this unit's questions. Okay. If there is no question, I would be happy to do a quick teaching on infection control and prevention. Are we up for that?
Yes, Chris, no problem. The same unit we are like carrying forward?
Yes.
It's yesterday's unit, right? Third unit.
Yes. Yeah, yesterday's unit. So a few things that
we can do that. We still have half an hour.
Yeah, that's right. Thank you.
So, but we have discussed all the questions, or the questions are still there?
No, we finished all the questions. There are not many.
So the questions based on infection is not there in the assignment? They are
there in the assignment. I covered that, but then just some further clarification on them. Is that okay?
Yeah.
Okay, so this is infection.
I think we have total 18 units in this to cover, right?
Yes, we are doing so well. The way we are going, we are doing very well.
Yeah.
And you guys are amazing. Yeah.
You know what? Like when I did my level 3 for childcare.
Yes.
So when we were halfway through the module, the whole course, so our tutor gave us the break for at least maybe 2 weeks, I think, because that time it was coincidentally it was the Easter time or something.
Oh, okay.
So there were like no classes for the continuously 2 weeks. So we were given that time to complete the project, the case study and assignment and everything. So will that be the same case with us over here with you?
Yes, it will be the same thing. And considering last week we gave you 1 week here.
Yeah, but that was not you were not there.
What happened was no, it was that was my mistake. I stayed up all night to work on some documents.
And
then
you overslept the next day.
So my sleep was disrupted. So I decided to take some rest. I set the alarm to wake up for the lesson. Oh no, I was gone. So Mercy tried to call me. I think Dr. Jayton also tried to call me. I didn't hear anything at all. I woke up when it was 23 minutes past. I said, what? Then quickly I checked my phone. I realized that no, the alarm went off, but I didn't hear. And I saw Dr. Jayton's call. So quickly I called Dr. Jayton and I said, oh, I'm so sorry. I overslept. And he's a good man. He said, don't worry about it, Chris. What shall we do now? I like his approach all the time. Yeah. All right. So thank you for your understanding. Yes, so we'll give you considerable time to do the assignment.
Yeah, maybe like once we are done with 8 to 9 units, then we can have a break at least,
Sure. So that there will not be much pressure. Yeah. Okay.
Yeah.
Thank you. All right. So shall we use 20 minutes to finish this now?
Yeah, we can start.
Okay. All right. So infections and infectious diseases in human beings are caused by harmful germs, okay? And the germs are known as pathogens. And they enter the human body. And once they enter the body, they begin to multiply. So the best thing to do is to make sure we don't allow germs to enter the body, because once they enter the body, they begin to multiply. And that is the main reason why we should have infection prevention and control. So once we prevent the germs from coming in, then we are healthy. We don't have any problem. We'll not need the doctor. We'll keep healthy, and our children will keep healthy. Our staff will keep healthy. Our service users will keep healthy. So that's the definition of infection. How do you call it? So these microorganisms are so small that they can only be seen by the use of the microscope. So what are pathogens? a pathogen is something that causes a disease. You see? So pathogen is something that causes a disease. A disease is caused by pathogens. So let's look at this. Pathogenic organisms can be either a bacteria or viruses, like we saw with what happened during the last pandemic, or fungi, or parasites, or protozoa. These things, any of these are pathogenic organisms which cause disease. Yeah? Okay. Now, we're talking about health and safety in adult care setting. And the thing is that both adults and children can be vulnerable. When we talk about a vulnerable person, it's someone who cannot take care of themselves, cannot protect themselves, cannot depend on themselves, cannot defend themselves. I'll take it again. A vulnerable person is someone who cannot take care of themselves, cannot protect themselves, and cannot defend themselves. And so they depend on other people, particularly care workers or healthcare professionals, for health and social care services. That is what a vulnerable person is. Now, in this case, we are talking about vulnerable adults. So a vulnerable adult is someone from the age of 18 who cannot take care of themselves, and they depend on other people for their care, and they cannot defend and protect themselves. And these are the people that we have to work hard to make sure we protect when it comes to infection control and infection prevention. Right, so some groups of people may be more vulnerable to infection, basically because of their age, like the vulnerable adults, our grandfathers, our grandmothers, and other times because of their maybe pre-existing ill health condition or general health condition that they have. So they are prone to infection so easily. So in these groups, if these groups become infected, the symptoms may be serious and life-threatening. Why? Because of their age. So microorganisms that are resistant to antibiotics can make it difficult to treat the illnesses that this group of people get as a result of the infections. And that is why in the health and social care environment, particularly adult care, we do everything possible to make sure they don't get infected. And some of the things that we do are those that we are going to be talking about. But we can't talk about that without looking at the infection, the chain of, how do you call it? Infection. The chain of infection. So this is the chain of infection. Sorry, I'm going to quickly. In order for the spread of infectious diseases to take place, what we are saying is that in order for diseases to spread, the chain of infection must be completed. So infection goes through a particular cycle. We call it the chain of infection before somebody becomes infected. Okay, so this is the chain of infection. It starts from the top here. So can I have Sarath? Could you take us through wherever you see the cursor? Okay, so you're starting from the top here. So this is the beginning of the chain or the stage. Can Sarath hear me? You may be muted, Sarath. Okay, let me start while we wait for Sarath. So we call something causative agent. The word causative is from the word cause. What's the cause of it? Okay, so the causative agent is called the pathogenic organism. Don't forget, we talk about pathogen here. A pathogen is something that causes disease. Okay, so the thing that causes disease is the beginning point of the infection change. It's here. Then it finds a reservoir. The reservoir is where it stays. That is the source. Then it moves from the reservoir to what we call a means of exit, the way out of the body. It moves from there and begins to look for a place to stay. And it can only move from there to a place to stay when an opening is created and it has a way of being transmitted. So you see, the next stage is the mode of what? Transmission. That is the method through which it leaves, it exits the source, the reservoir, to enter into another place. Sometimes, and most of the time, into somebody's body. Okay, so the mode of transmission may be somebody has touched something that has the pathogenic organism and is touching another person's body. So it has just quickly transferred it. That is why we encourage that we wash our hands or sanitize our hands so that nothing is spread through our hands into another person's body. And it's also very important we are careful, especially these times, with handshakes, because you don't know where somebody's hand has been, what the person has touched, particularly when you travel somewhere in London on the underground. People are holding the rails, or traveling on the bus and holding the rails and touching things. And then children come around, you touch them. No, it's very important whenever we get home from outside, first thing we do is we wash our hands or sanitize our hands even before we touch our children, so we don't transmit anything to them. And this is exactly the same thing we do at the place of work. So when we are going to take care of a service user, we make sure we wear gloves, we wear our aprons, that's the PPE, how to prevent the spread. And after taking care of that service user, we remove the aprons, remove the gloves, we wash our hands, or we sanitize our hands before we go to attend to the next service user, or before we go to do anything else. So the mode of transmission, that is how the pathogenic organism, or in this case, we are talking about, the infectious agent moving from there. Then we have the portal of entry, the way into the body, how it enters into somebody's body, somebody's, system. And then that is what we call the person at risk. So once it enters into somebody's body, that person becomes at risk. We say the person is infected. So infection has become effective in the person's body. And we say this person has an infection. So this is the chain of infection. Okay? Not until this chain is completed, infection hasn't occurred. It hasn't spread. Any question? Okay, so let's look at breaking of the cycle, or the breaking of the chain of infection. Nina, would you like to read for us, please?
Breaking the chain?
Yes, please.
Okay. Preventing infection means breaking the links in the chain so that an infection cannot be spread. Not everybody who carries harmful microorganisms will show symptoms. Examples of standard precaution taken in every situation to reduce the risk of infection.
Okay. Very good.
Hand hygiene, safe disposal of waste, safe management of laundry, correct use of personal protection equipment, PPE.
Very good. Thank you very much. You read very well. This just answers one of your questions. Okay, so this is one of the ways to reduce the spread of infection or prevent infection from spreading.
Yeah, so the best example for this is a recent one, COVID.
Absolutely. So you can use that example in your assignment as well. And so what hand hygiene technique were we using during the COVID?
Washing your hands.
Washing our hands frequently.
And like when there was it was the new in the world, so people were so much, careful not to even touch their own nose, and while sneezing, it was so paranoid everywhere.
We were
But
all very
now,
isn't it?
those were the days.
Yeah.
Safe
Very good.
management of laundry, and then I think this sanitization, basically, right?
Yeah, it
Should be
comes
there.
under hand hygiene.
Yeah.
So you can discuss that under hand hygiene.
Mhm.
And when we talk about safe disposal of waste, here I want us to think about hospital environment and also think about care homes. You know, the elderly, the adults we take care of, okay? Some of them are incontinent. Incontinent means they can't use the toilet. They don't have control over their wee-wee. And
Yeah.
so number one and number two. So they have to be taken care of. When we clean them, it's part of what? Waste. And in the care home or or nursing home environment, there are different types of waste disposals. You know, some of the bins are red, some of them are orange, some of them are different colors. Each of them and what goes into them. General household waste or food waste goes into one. Things like syringes and sharps go into another. Other things that have to do with bodily fluid go into another. And that is why safe disposal of waste here is very, very important. If anything opens up and spreads, whatever the person is carrying in their body fluid can be exposed, and that can result in the spread of infection. I hope that point is clear. And the same applies to safe management of laundry. We are not talking here basically about how we do our household laundry. We are talking about how we wash the service users' clothes. Because in the care home, in the nursing home, in the residential home, we do laundry for them. And depending on what pre-existing conditions, don't forget these are elderly people. Some of them have pre-existing conditions, ill health, age-related things. We have to make sure that these are handled in a safe way so nothing is spread. Then we have to use the correct PPE, personal protective equipment. So the gloves, the apron, the goggles, or the face shields, and all the other things that we need to use with them, the mask, we have to make sure these are used according to the workplace policy and the procedure. If that is the policy, fine. If that is the procedure, fine. Now, in one of the hospitals that I work in, when the lockdown measures were being how do you call it, reduced, one of the intensive care units was now no longer allowing people to use aprons because the infection control department realized that the aprons were even carrying things to the bedside of patients. So the only thing they allowed us to use in the ward when you are going to see a patient is to just wear gloves if you are going to have contacts. We are going to maybe hold or touch the patient's hand, or if you're going to have any contact with the patient, then you wear gloves. But apart from that, you don't wear gloves, you don't wear apron if you are not going to have any contact with the patient. You are just going to stand by the bedside and have conversations. So different policies and different procedures at different trusts and adult care settings, depending on what the assessment and the review says. Yeah. So that's how we break the chain and prevent infection from diseases from spreading. Okay. Your health and hygiene. You have an important role to play in preventing the spread of infections. So these are some of the other measures. Vaccinations. So yes, was there vaccination during the pandemic? Yes. And some of us have 2 vaccinations. Illness, taking safeguards, taking precautions. When you are ill, you don't go to work, you call in sick so that you don't allow it to spread to other people. Clothing, that's PPE, personal protective equipment. Make sure that we wear the appropriate clothing. Personal hygiene, we keep ourselves safe in order to keep others safe. Skin health, you have to make sure these are in good shape. good hand habits, again, like what Nina read to us, hand hygiene. So these are some other further steps we need to take, and then make sure that we don't share or use the same needles with anybody. That is also important. All right, Sarath, please, shall we have you read this for us? Take us through hand hygiene. Sarath, are you there? We have 10 minutes.
Hand hygiene. Hand
Yes.
hygiene is, yeah. Hand hygiene is is an important part of preventing infection. Hands can be cleaned or decontaminated by washing with water and soap that remove dirty and germs from the hands but doesn't heal them. Using alcohol hand rubs and gel which kill most bacteria.
Yes. So these are the two main ways. So the hand washing or the use of the sanitizer or alcohol hand rub. 5 moments for hand hygiene. Yes, Nina, please.
Yeah, the World Health Organization has identified 5 moments when health and social care workers should clean their hands. These moments are before touching the individual you are supporting,
Good.
immediately before carrying out a clean procedure, after exposure to body fluids and after removing gloves, after touching the individual you are supporting, after touching the area or objects surrounding the individual you are supporting.
Very good. So these are further ways to prevent the spread of infection and to control the spread of infection, particularly in relation to hand hygiene. Hand hygiene is a very important thing. So these are some of the times that we should make sure we apply the hand washing or the use of the sanitizer as a way and a means of controlling the spread of infection. Thank you. So infection control, effective way of hand washing. For hand washing to be effective, this is how we do it. Every part of your hands, my hands, are carefully washed, then rinsed and dried. These 3 steps. It must be carefully washed with water and soap, preferably warm water. It must be rinsed after using the soap, and it must be dried, either using the hand dryer or the hand towel. Now, these steps are the most effective to ensure that our hands are properly or correctly washed. The first thing to do for effective hand washing, the first thing to do is what? We wet our hands and wrists thoroughly using warm running water. Most of the time, people think the first thing to do is to get the liquid soap. No. The first thing is not to get a soap. We have to wet our hands first under the water. That's the first thing to do. The second
I
thing.
can't hear anything. I mean, it is gone.
Sorry?
Everything is breaking.
It's breaking. Oh, sorry. Nina, is it breaking from your side as well?
No, I'm fine.
Oh, okay. So I think it might be the network, Sarat. I'm sorry about that. So the second thing to do is to apply the foam soap or the liquid soap. And the third thing to do is to produce a good lather, rubbing our palms together, interlock, like what we saw yesterday on Monday.
Chris.
Yes. I can hear you, Sarat. Can you hear me? We have 6 minutes, so can we just finish this and then we can listen to the recording later? Is that okay? So the third stage, Sarat, is that okay? The third stage is to produce a good lather with a soap because our hand is wet. Rub our palms together, interlock our fingers, and rub together again. The third thing is to rub our palms, ensuring our fingertips are clean and fingernails are all clean to ensure that the backs of our hands are leathered and cleaned. And then the fifth thing is to rub our fingers locked, maintaining good lather, and ensure that the wrists are clean as well. The last thing is to rinse our hands under the running water thoroughly, and then we dry our hands. Okay, so these are the effective ways of maintaining good personal hygiene. The rest have to do with personal protective equipment, uniforms, disposable aprons. I talk about paper towels and soap, hand cleansing gel or wipes, then the gloves, masks and respiratory masks, the goggles or the face shields for eye protection, then how to handle soiled linen in relation to laundry. These are also very important. That comes under what we talked about, safe laundry. So these are the key ways of maintaining, preventing, and controlling the spread of infection. So with the lining can become lining can become contaminated with harmful microorganisms and body fluids. These come from the beds on which the adults or the residents or the individuals sleep on. And because some of them have incontinent issues, wee on their bed and do number 2 on the bed, all of those things, precautions for dealing with this contaminated linens
actually
are important. Sarah, you still can't hear me? Okay, I think when you listen to the recording, that should be fine. Is that okay, Sarah? I'm very sorry about that. So we'll just conclude with this. So these have to be washed separately. It has to be washed at this temperature, followed by tumble drying or hot ironing, and washing bedding and towels in a hot wash. It's very important. Sealing laundry in color-coded bags and moving to washing area. And this is what happens in the residential homes or care homes or nursing homes, and washing infected linen immediately if you supporting people in their homes, that is home care or domiciliary care settings. I'll be happy if you take time to look at these questions later. Let's do this first one. Hand drying is an important part of effective hand washing. Is that true or false? Is that true or false? Okay, let's look at this question. Hand washing.
Sorry, Chris, what did you ask? Hand drying?
Okay, so we're just trying to look at these questions.
Okay.
Just a form of quiz. Hand washing kills all bacteria. Is it true or false? Hand drying is an important part of effective hand washing. Wearing gloves avoids the need to practice hand hygiene. Alcohol gel works in the same way as hand washing. But let's just look at them and see what you come up with, okay, as the answers.
Okay.
All right, they are there. Yeah.
Okay.
All right. So thank you for listening. Thank you for participating. It's good to have you here. What I would encourage you to do is, have you finished the first 2 assignments?
What finished what?
The first 2 assignments.
No.
Okay. All right. Then we'll hear more about that and we'll see what we can do to help and support you. Is that okay?
Yeah.
Thank you for being
today
here.
is what? Today is what date?
Today is Wednesday. Our next lesson will be on Monday.
Yeah.
Yeah.
Today's my cricket. You didn't know.
All right. So thank you very much. And I will request Mercy to kindly stop the recording. And hopefully I should see you on Monday. Is that okay?
Okay, Chris.
Thank you all.
Thank you. Bye.
Okay. Bye. Bye.
Bye.